Your doctor gave you the prescription. Take 1 tablet daily. And if you are over 60, there is a very good chance you turn that into a routine. Same pill, same kitchen, same glass of water, maybe the same cup of coffee every single morning. And that is exactly why this matters. Because with blood pressure medication, the most dangerous mistake is usually not refusing to take it. It is taking it faithfully, at the wrong time, in the wrong way, with the wrong routine wrapped around it. And after 60, those mistakes hit differently. Your arteries are less forgiving. Your blood pressure is less stable. Your risk window is narrower. What looked harmless at 45 can become dangerous at 65. Here is the part almost nobody explains clearly. There is not just one dangerous time to take blood pressure medication. There are several, and one of them may already be built into your daily routine. I am Dr. Clara Hoffman. I created this channel because the conversation that protects your heart should not be squeezed into a rushed appointment and forgotten by the time you reach the parking lot. And today, I want to walk you through the 5 timing mistakes I see again and again in adults over 60. Some are common. Some are surprisingly dangerous. And number 1 is the one most people assume is correct, simply because it has been repeated for years. Before we go further, I want you to think about your own routine. Morning dose, bedtime dose, with coffee, with breakfast, after you remember you forgot. Because blood pressure medicine does not work in isolation. It works inside a clock. Your body follows a circadian rhythm. Blood pressure is usually lower at night, and in many healthy people it dips by about 10 to 20% while they sleep. Then it rises again in the morning as your body prepares to wake, move, think, and stand. That morning rise matters, especially in older adults, because morning blood pressure surges have been associated with cardiovascular events. Source. That means timing is not a small detail. Timing is part of the treatment. So let's start with mistake number 5. Mistake number 5 is taking your water pill too late in the day. If you are on a diuretic, something like furosemide or another medication designed to help your body shed extra fluid, timing is not optional. It is practical medicine. These drugs do exactly what they are supposed to do. They make you urinate more. That is the mechanism. That is the treatment. But when you take them late in the afternoon or at night, the effect does not politely wait until morning. It shows up when you are trying to sleep. Now you are waking up at 1 in the morning, or 2, or 3. You stand up in the dark. Your pressure shifts. Your balance is not what it used to be. And suddenly, this is no longer a blood pressure story. It is a fall story. The NHS specifically advises not to take furosemide too late in the day, especially after 4 p.m., because you may have to wake up to go to the toilet. Source that sounds simple, but in adults over 60, simple problems become serious problems fast. If your diuretic is keeping you up, waking you repeatedly, or sending you to the bathroom at night, the dose may be correct, but the timing may be wrong. The practical rule is straightforward. If you take once-daily diuretic, earlier in the day is usually safer than late evening. If you take it twice daily, your second dose should not drift toward bedtime, unless your doctor specifically told you to do that. Mistake number 4 is taking your blood pressure pill right on top of your coffee and assuming that makes no difference. A lot of people do this without thinking. Pill, coffee, done. But caffeine is not neutral. Mayo Clinic notes that caffeine can cause a short-term spike in blood pressure, especially in some people. Source that does not mean coffee is forbidden for every person with hypertension. It means you should stop pretending it is invisible. If you are taking a medication to calm your cardiovascular system, especially something that lowers heart rate or helps control pressure during the early part of the day, and you immediately stack that with caffeine, you may be creating a push-pull effect right inside your morning routine. In some people, that means nothing dramatic. In others, it can mean palpitations, shakiness, false reassurance from one reading, or confusion about whether the medication is really working. Here is the key question. Are you measuring the medication? Or are you measuring the medication plus caffeine, plus stress, plus rushing out the door? Those are not the same thing. If you notice your morning readings are higher after coffee, or you feel off right after taking your pill with caffeine, stop brushing that off. Space them out. Track the difference. Bring the pattern to your clinician. Mistake number 3 is forgetting that food and drink can become part of the prescription. especially grapefruit. This one catches people because it feels harmless, it feels healthy, it feels like breakfast. But if you are taking amlodipine, the NHS says clearly, do not eat grapefruit or drink grapefruit juice while taking it because it can increase the chance of side effects. Source: that matters because side effects from blood pressure medication are not always dramatic movie scenes. Sometimes they are dizziness. Sometimes they are weakness. Sometimes they are that moment when you stand up and realize the room moved before you did. And over 60, dizziness is never just dizziness. It can become a fall. It can become a fracture. It can become the beginning of a completely different health problem than the one you thought you were treating. So if you are on amlodipine or another calcium channel blocker, do not assume your breakfast habits are irrelevant. Ask specifically. Read the leaflet. Confirm the interaction with your pharmacist if you are not sure. Mistake number 2 is trying to fix a missed dose by doubling up later. This is one of the most common medication mistakes because it feels logical. You forgot your tablet in the morning. You remember at night. And your brain says, I'll just take 2 tomorrow. Or I'll take 2 now and get back on track. That instinct is understandable. It is also exactly where routine turns risky. For amlodipine, the NHS guidance is explicit. If you miss a dose, skip the missed dose and take your next dose as usual. Do not take 2 doses to make up for it. Source: that is the kind of sentence people skim past. Do not skim past it because blood pressure medication is not like catching up on emails. You cannot always make up a missed tablet by stacking more drug into the same window. Depending on the medication, doubling up can drop pressure too far, trigger dizziness, or create a rebound of confusion in your routine that is worse than the original missed dose. And there is a second version of this same mistake that is quieter. People who were prescribed one schedule slowly invent another. Twice daily becomes once daily because it is easier. Bedtime becomes morning because it is easier to remember. Morning becomes whenever I get to it. That is not adherence. That is self-editing a prescription. And once you start doing that, nobody is really evaluating the medication you were prescribed. They are evaluating the version you created. Now we come to mistake number 1. The biggest one. The one hidden inside advice millions of people have heard for years. Assuming that morning is automatically the safest and smartest time to take your blood pressure medication. This is where the conversation gets more nuanced and frankly more honest. For a long time, many patients were simply told to take blood pressure medication in the morning. It became standard, convenient, familiar, easy to remember. But physiology does not care about habit. Your blood pressure has a pattern. Your risk has a pattern. Your medication has a peak, a duration, and a window where you need it most. That is why bedtime dosing became such a big conversation in hypertension research. Some earlier studies suggested major benefit when at least some blood pressure medications were taken at bedtime rather than on waking. The Cleveland Clinic Review summarizes 2 influential studies, MAPEC and HYGEA, that reported large reductions in cardiovascular outcomes with bedtime dosing. But that same review also notes that those results were heavily questioned because the effect size looked improbably large and the methodology was criticized. Source: then came the time trial, a very large randomized study with more than 21,000 patients, and its finding was much more sobering. Evening dosing was not different from morning dosing in major cardiovascular outcomes. The primary endpoint occurred in 3. 4% of the evening group and 3.7% of the morning group, and secondary cardiovascular and mortality outcomes were also not different. Source: that means if you were waiting for a simple answer like everyone over 60 should take blood pressure medicine at night, the evidence does not support that. But here is the mistake most people make. They hear that and conclude timing does not matter at all. That is also wrong. Cleveland Clinic's bottom line is more precise. Current evidence is insufficient to recommend routine evening dosing for everyone, and dosing should be individualized based on risk factors, side effects, and adherence. They also point out that blood pressure normally follows a day-night rhythm, and that morning surges have been associated with cardiovascular events. Source: so the real issue is not morning versus night as a slogan. The real issue is whether your current timing matches your actual pattern. Are your morning readings still high? Do you forget doses at the time you were told to take them? Do you feel lightheaded after taking them? Are you a person whose blood pressure does not dip normally at night? Do you need better overnight coverage? Or do you need a schedule you can reliably follow every day? That is the adult question. That is the medically useful question. And for some patients, especially those with concerning morning readings or suspected non-dipping patterns, the next right step is not guessing. It is asking about 24-hour ambulatory blood pressure monitoring, so the decision is based on your real pattern, not a generic label on a bottle. Source: so if you are over 60, here is what I want you to do before your next refill, your next follow-up, or your next casual, I've always taken it this way conversation. Ask 3 questions. What time is this medication supposed to protect me most? Is my current schedule helping adherence or hurting it? And based on my blood pressure pattern, should I stay with morning dosing, switch to bedtime, or consider monitoring first? Those 3 questions are better than blind habit. And blind habit is what puts a lot of people in danger. Because the most dangerous time to take your blood pressure medications is not just morning, it is not just night. It is the time that leaves your real risk uncovered, the time that causes you to skip doses, the time that collides with coffee, grapefruit, dizziness, bathroom trips, and the false confidence of I take it every day, so I must be doing it right. You may be doing it consistently. But consistency is not the same thing as precision, and after 60, precision matters more than most people realize. If this changed the way you think about your routine, then do not ignore that feeling. It means you just found a question worth asking before the next tablet, not after the next problem. I am Dr. Clara Hoffman, and this is exactly the kind of conversation every patient deserves to have before blood pressure medication becomes just another habit on the kitchen counter.